I've tried to leave MSF 3 times and I'm still here 6 years later. That says it all, basically. MSF gives me a chance to do everything I want to do with my medical career. Full stop. It's simply that. As a doctor for MSF, primarily you will be seeing patients and you will be managing the local staff. It depends very much on the project. So mobile clinics, it's very much just you, 100 patients a day, for example, doing basic consultations out in the wilderness. If you are an MD supervisor in a hospital, on the other hand, you might be doing hiring and firing, rotas, tutorials, teaching programs, as well as being the consultant, so providing ad hoc medical expertise for the patients and doing ward rounds regularly within departments, so acting as the medical director. In all cases, you'll be responsible for stock, responsible for statistical reporting, and responsible for being a good team member, so you'll carry as many boxes as the lot. Working for MSF as a doctor is very different to the NHS. You will more than likely and more often be the be-all and end-all. You will be clinically responsible, whereas if you're still a registrar in the NHS, you still have your consultants to call. On a regular daily basis, you are that care provider and you're the ultimate responsible. So it's very different from the NHS in that sense. Also, of course, in terms of resources and backup, and inside MSF we have a lot of resources and backup, but we don't have CT scans, you don't have ultrasounds, you most often don't have x-rays, rapid diagnostics only, basic blood, so you're using a lot of your clinical skills, you're doing a lot of things with less certainty of diagnosis or less certainty of outcome, so that can be difficult if you yourself are not clinically experienced. There's also differences in terms of the work structure. You might be in a more emergency setting where you do 7 days a week, 12, 14 hours a day consistently. So and that's not a shift pattern that you will find in the NHS. It's really difficult to overcome the limitations of not having full diagnostics or full backup or full referral services onward for the patient. It's very hard sometimes to know what you want to be able to achieve for the patient, but also know that you can't because you don't have what you need. You need to learn to accept that the standard of care is different. It's hard to deal with. You need to practice sometimes at the limit of your expertise, do the best you can with what you have, and just accept that you are going to have a difficult job. It is not as idealistic as you believe it's going to be. There are some resources that MSF will not give you for strategic reasons. And these are things that medics who have tried their whole life to come to MSF are going and they're like, I'm going to save Africa. And you rock up there and then your medco says, you're not going to get this. I'm sorry, we're not here for that. That's really hard to stomach. And those limitations are half the reason a lot of medics, it was my experience, feel disillusioned with MSF after the first mission and don't come back. The best thing about being a doctor with MSF for me personally is the immense feeling of job satisfaction. One does when one becomes a medic, you feel like you want to make a change to your patient's life. In the NHS with a very medicalized patient population, you're making little changes more often than not. But with MSF, you will be quite literally sometimes the only doctor that patient has seen for years, and you may make a significant impact on their life. And that is very, very satisfying. The worst thing about being a medical doctor for MSF is probably the amount of death you'll see. You will not be prepared coming from the NHS for seeing that much death. And it's probably even worse because you know that it's preventable. For me, I can't stomach very easily knowing that we have a healthcare system where nearly all of the patients that I see inside MSF would probably survive if they were in our healthcare system in England. And that's really difficult to stomach. don't underestimate the difficulty, but don't underestimate the joy and satisfaction equally. They go hand in hand. It is super tough doing MSF, but you walk away with a huge satisfaction.